Hi, I'm Claire, and this is my TED Talk. And this is my audience.
I'm Philip.
That was Philip, and I'm his dad, Mark. I'm looking forward to this evening's show.
Hi, I'm Rachel. I'm Claire's sister.
Hi, I'm Colin.
Buenas noches. I'm Claire's mother. So think back to a time when you or your loved one had to spend some time in a hospital. How was your experience? The nurses? How was the waiting time in the waiting room or at any other points during the stay? If your experiences were good, then you are lucky and you may soon be of the minority. If your stay at the hospital was poor, then it is very likely that you have experienced what is the beginnings of a very severe healthcare worker shortage. I am a nurse's assistant on a gastrointestinal rehab unit. It is a small unit, only 12 beds. So you think it wouldn't be difficult to staff enough nurses for only 12 patients. But the reality is that on the unit I work on and on units all over the world, there are not enough nurses or other healthcare professionals. According to the Center for Disease Control, in the U.S. alone, there are 35.1 million people that are hospitalized each year. As of right now, the world is short 7.2 million healthcare workers, and in 2035, it is projected that the world will be short 12.9 million workers. This number will continue to drastically worsen due to the aging baby boomer population. As the baby boomers age, there will be a huge influx in the elderly population of the United States. This will lead to more hospitalizations and an increase in the number of people in nursing homes, and in turn, there will need to be an increase in healthcare workers to match. On a more trivial note, but still stressful and very annoying, emergency department wait times will also follow this worsening trend that we are seeing. From 2003 to 2009, wait times increased 25%, from 46 to 58 minutes. As more people need hospitalization and less people choose a career path in healthcare, wait times will become unbearable. So what can be done to stop, or at least slow down this issue? Action should first start with preventative healthcare. Although many Americans have started moving towards the healthy lifestyle trend that is currently happening, it is still necessary to stress the importance of preventative healthcare. Many illnesses and conditions that are the reasoning behind millions of hospitalizations can be prevented or at least slowed by maintaining a healthy lifestyle. The more healthy people, the less hospitalizations. Next, focus should be on retaining the current healthcare workforce and then in attracting students into the field of healthcare. A good workplace environment is a key component to attracting and maintaining a good workforce. People will be more inclined to work at a place that is safe and sanitary. Safety and cleanliness regulations should be placed and very strictly enforced in all healthcare facilities. Next, providing incentives to current and future healthcare workers will help to slow down the shortage. Some ideas are student loan forgiveness programs and higher pay that could be offered as incentives for entering the healthcare field. A healthcare worker shortage is not only a safety issue for all current and future healthcare facility patients of the world, but it is also an issue for healthcare workers themselves. Nursing, and other fields alike, is a very physically, mentally, and emotionally demanding job. It would simply not be possible or humane for the current number of nurses to have to care for the rising number of patients. As far as the patients, the safety issues are evident in many areas. One example, which is very common, are those patients who are unable to ambulate on their own and need assistance to go to the restroom. If nurses are too busy caring for all of their other patients, then that patient might not be able to wait any longer and attempt to get up on their own and could fall. In the end, a healthcare worker shortage would be extremely detrimental for the United States and the entire world. People worldwide should be able to keep their health for as long as possible, not have it halted due to this issue. As the World Health Organization simply states it, it's a universal truth: there's no health without a workforce. Thank you.